Hi, my name is Randy Friedman, and today we are going to discuss breastfeeding. Breastfeeding is a natural gift from mothers to babies and has been recognized by the American Dietetic Association as the healthiest food for infants. Pregnant women are often bombarded with information about breastfeeding versus formula feeding in books and other publications, but it comes down to one simple principle. Babies are born to be breastfed, no questions asked. It is important for mothers to recognize just how beneficial breastfeeding is, not only for her baby, but also for herself and for society as well. Her milk provides the baby with the best possible nutrition and disease protection. The stimulation of hormones is also designed to help mom get her body back. Society benefits economically and experiences overall lower incidence of illnesses due to the composition of breast milk. The American Academy of Pediatricians has long recognized breast milk as a necessity and encourages mothers to exclusively breastfeed for the first 6 months of life and continue to breastfeed with the addition of supplemental foods for at least 1 year. Infants obtain sufficient water, fat, protein, carbohydrates, vitamins, and minerals from breast milk that promotes healthy weight gain. The infant also receives antibodies produced by the mother through breast milk consumption that protect against viral and bacterial diseases. There is no known manufactured formula that can provide these valuable components of breast milk. The Centers for Disease Control and Prevention show much lower rates of hospital visits for breastfed babies compared to formula-fed babies. The World Health Organization has also released information indicating that exclusive breastfeeding reduces the occurrence of multiple illnesses, such as ear infections, diarrhea, sudden infant death syndrome, respiratory infections, allergies, asthma, and type 2 diabetes. After so many confirmations of improved health with breastfeeding, why do mothers choose formula? Maybe this will help convince them. The hormones involved in provoking the milk ejection reflex during lactation provide key benefits to postpartum mothers. Oxytocin and prolactin are produced by the stimulation from breastfeeding and cause the uterus to contract. These contractions allow the uterus to return to the pre-pregnant size at a faster rate so the mother can get back to normal size quicker. Consistent production of these hormones can also act as a natural birth control and assist moms in spacing out their pregnancies. Women can become pregnant just weeks after delivering, and that does not allow enough time for her body to be in the optimal state to carry a baby. Milk production also requires the body to burn hundreds of calories at each feeding session. This helps mom return to their pre-pregnant weight and can play a role in decreasing the risk of maternal type 2 diabetes. Recent studies that have been confirmed by the United States Surgeon General indicate that prolonged stimulation of these hormones also reduces a woman's risk of breast and ovarian cancer. Now that we discussed why breastfeeding is the healthiest option for baby and mom, let's investigate how breastfeeding positively impacts society as a whole. Formula costs the economy millions of dollars each year. A family has the potential to save $1,800 each year by breastfeeding instead of formula feeding. If there was less of a demand for formula, government assistance programs such as Women, Infant, and Children could concentrate their resources targeting other aspects of health promotion. Since breastfeeding does not require bottles, it reduces the cost of production of materials like plastic and tin for bottles, nipples, and formula packaging, including cleaning supplies. It is also profitable for employers to promote breastfeeding among their female employees as well, because a lower risk of illness of the mother and baby, which is provided by breast milk, means lower costs in healthcare. Studies from the Centers for Disease Control and Prevention have also indicated that breastfeeding reduces employee absenteeism for postpartum mothers. After being enlightened on all the benefits of breastfeeding, there should no longer be a question of how a new mother will feed her baby. According to the Surgeon General of the United States, breast milk provides the optimum nutrition available for infants. This has been proved through a lower incidence of multiple diseases and less doctor visits for breastfed babies compared to formula-fed babies. Mom can also use breastfeeding to provide several times a day to bond with her baby while helping her body recuperate from the pregnancy. Breastfeeding should be promoted by medical professionals, at home, at work, and in the community. Formula feeding should only be in extreme medical circumstances where it is recommended by a physician, when it is time to feed your baby. Remember that breastfeeding is the healthiest option for both mom and baby.